Vitamin D supplements and prevention of cancer and cardiovascular disease. Vitamin D is a fat-soluble vitamin that is naturally present in very few foods added to others and available as a dietary supplement. It is also produced endogenously when ultraviolet rays from sunlight strike the skin and trigger vitamin synthesis.
It helps keep your muscles strong and your bones from breaking, but most Americans don't get enough vitamin D.
A substantial proportion of the population may well have what we would call either vitamin D insufficiency, where it's kind of borderline low, or frank vitamin D deficiency.
Mayo Clinic's Dr. Sandeep Khosla says exposure to sunlight is the easiest way to get vitamin D. Generally, 30 minutes a day does the trick. But that can be tough for a lot of people, especially during the winter, so food and drinks can help fill the gaps. Most dairy products these days are fortified with vitamin D, as are some other items like orange juice. But Dr. Khosla says vitamin D-filled food options are limited.
For many people, taking a vitamin D supplement is perhaps the best way to ensure adequate vitamin D amounts.
But recent studies show excessive vitamin D supplements might lead to kidney and heart issues, an increase in fractures and falls, and even certain types of cancer.
The bottom line is you need to get enough vitamin D. 600 to 800 units is probably enough.
For the Mayo Clinic News Network, I'm Ian Roth.
Applications of vitamin D. It is required for the regulation of the minerals calcium and phosphorus found in the body. It also plays an important role in maintaining proper bone structure.
Hey friend, I was just wondering, what exactly is vitamin D?
This is an excellent question. Let me tell you the story of where vitamin D comes from and how it keeps us healthy. Have you ever been stuck inside on a cloudy day and wish you were on the beach? On a bright summer's day when the sun hits your skin, this helps our body to make vitamin D. Even though we get some vitamin D from the sun, we must also make sure we get vitamin D from the food we eat. This includes fish, beef on our hamburgers, orange juice, eggs, and milk. Do you know of anyone who has ever fallen and broken a bone? Well, vitamin D can help prevent this from happening. Our bones help us to stand up straight and move around on a daily basis. Vitamin D keeps us healthy by making sure our bones are as strong as they can be. Have you ever been terrified of visiting the dentist? Well, no fear. Vitamin D helps to keep our teeth healthy, which will surely impress the dentist. Next, as we get older, so does our brain. But vitamin D helps to keep our brains young and keep us smart. Vitamin D also helps to help us stay focused when we are working on these math problems. Also, when we get sick, bad bugs enter our body through our mouth. We have a system in our body that helps to fight off these bad bugs. Vitamin D keeps us healthy by making sure the system is working. Even if we don't eat a lot of vitamin D, this system may get confused and start killing what is our own. Sometimes when we get sick, the small cells in our body divide really quickly. When this happens, we get a lot of cells that build up because there's no place for them to go. Vitamin D can help prevent this from happening. To continue, our heart is very important as it keeps us alive and healthy. But sometimes, when we aren't healthy, our blood vessels get very small and nutrients can't get to our heart. But vitamin D can make these vessels larger so that the heart can get its nutrients such as oxygen through the blood. Even more, under our lungs, there's a very important organ called the pancreas. The pancreas releases something called insulin. Insulin helps to lower our blood sugar levels. Vitamin D keeps us healthy by making sure our blood sugar levels stay where they should be. When we breathe in oxygen, this is what keeps all of our organs alive, and it is our lungs that help us to do this. Have you ever focused on your breathing? Watch your chest go out and in. Our lungs help us to breathe, and vitamin D helps our lungs to work properly. Overall, vitamin D keeps us healthy and it keeps the doctor away. Now that's the story of vitamin D. I hope you learned something from this video.
Cardiovascular diseases. Cardiovascular diseases are conditions that affect the structure of function of your heart, such as abnormal heart rhythm or arrhythmias, aorta disease and Marfan syndrome, congenital heart disease, coronary artery disease, deep vein thrombosis and pulmonary embolism, heart attack, heart failure, heart muscle disease, heart valve disease, pericardial disease, peripheral vascular disease, rheumatic heart disease, stroke, and vascular disease.
Cardiovascular disease involves abnormalities of the heart and blood vessels. Coronary heart disease is the most common condition and is the leading cause of death in the United States for both men and women. The lifetime risk for developing significant cardiovascular disease is greater than the likelihood of developing cancer. Your heart is a muscular pump that requires heart arteries to supply oxygen-rich blood to keep it going. Coronary heart disease occurs when these blood vessels become narrowed due to a buildup of plaque. The plaque is made up of cholesterol and other substances. This process is called atherosclerosis. Atherosclerosis occurs over a lifetime and is influenced by risk factors. Some risk factors can't be changed. However, others can be altered through healthy lifestyle choices and medications if needed. Symptoms of coronary heart disease occur when the heart muscle does not get enough oxygen. Some describe this as chest pressure or chest pain that starts over the left chest and can radiate or travel to the left arm, left jaw, back, or sometimes to the right chest. Some patients do not have any chest pain or pressure symptoms, but instead have intense shortness of breath or epigastric discomfort that can feel like a bad heartburn. Breathlessness, nausea, vomiting, or sweats can also sometimes be associated. These symptoms are called angina. There are many treatments for angina, including medications, angioplasty and stents, and bypass surgery. Aggressive risk factor modification is part of every treatment plan. Coronary heart disease can have serious complications, including heart attacks and even sudden death. Fortunately, developing significant coronary heart disease is largely preventable. Early prevention is best, but you can still improve how you'll do, no matter how old you are, by reducing your risk factors. One study found that 50-year-old people who had not already developed significant cardiovascular disease and didn't have major risk factors reduced their lifetime risk for developing significant cardiovascular disease, and they live longer. Continue on through this section to learn more.
Cancer. Cancer is the uncontrolled growth of abnormal cells in the body. Cancer develops when the body's normal control mechanisms stop working. All cells do not die and instead grow out of control, forming new abnormal cells.
Cancer is a group of over 100 diseases characterized by abnormal, uncontrolled cell growth. In a healthy body, cells grow, die, and are replaced in a very controlled way. Damage or change in the genetic material of cells by environmental or internal factors sometimes results in cells that do not die and continue to multiply until a mass of cancer cells or a tumor develops. Most cancer-related deaths are due to metastasis, malignant cells that penetrate into the circulatory system and establish colonies in other parts of the body. Great advancements have been made, but cancer is still the leading cause of death for people under the age of 85. In the United States, 1 in every 4 people die from cancer.
Pros and cons. Ecologic studies have shown lower rates of death from cancer and cardiovascular disease in regions with greater sun exposure than in areas with less sun exposure. Observational studies have shown associations between low serum levels of 25-hydroxy vitamin D and increased risk of cancer and cardiovascular disease. The cons are: it is uncertain whether supplements with vitamin D prevents cancer or cardiovascular disease because such results cannot establish causality. Observational studies are susceptible to confounding by outdoor physical activity, which correlates with sun exposure. Adiposity, which may decrease 25-hydroxy vitamin D, general nutritional status, and other factors that may produce spurious protective associations.
Vitamin D supplements are very controversial these days. For some years now, there's been a large promotion of vitamin D supplements, often by the nutrition industry and by non-medical personnel. There's been some recent studies that suggest that vitamin D might lower blood pressure, but these studies are not of the highest quality. There's also controversy because national authorities are not certain what level of vitamin D actually is a normal level and what constitutes a low level. Our advice is not to start vitamin D as a means to lower blood pressure. There's really not enough evidence to suggest that that's a beneficial approach. Again, caution is indicated. Not taking vitamin D unless there's a very clear indication is probably the right policy, with one exception. Calcium and vitamin D in women, particularly women at risk for osteoporosis, does have benefits. For the male gender, there's less evidence of benefit. There's uncertainty about what a normal level is. It's certainly not in prime time approach to lowering blood pressure and shouldn't be relied upon as a means to control blood pressure for those patients that have hypertension.
In conclusion, it is still uncertain if vitamin D supplements decrease the risk of developing cancer and cardiovascular disease.